Dr. Jenny C. McCloskey is a sexual health physician based at the Royal Perth Hospital in Perth, Western Australia. She often makes public speaking appearances, gives lectures, training, and preparation for best practices in the prevention of venereal disease. Dr. McCloskey is a prolific researcher and developer of treatments for the human papillomavirus in the genital tract. She became involved in her profession because she realized she had a knack for the industry and has reached her current successes through hard work. Dr. McCloskey completed a medical degree at the University of Melbourne in 1976, where she was the co-recipient of the Australian Medical Association Prize in Public Health. She completed her training as a medical registrar at the Sir Charles Gardner Hospital in Western Australia. Charles Gardner is a leading teaching hospital close to the Perth City Centre, offering a strong emergency care and general medicine staff. It is the notable home of Nobel laureate Professor Barry Marshall. In such a luminary medical environment, Dr. McCloskey gained extensive experience in various medical specialties, including hematology and oncology. However, it was venereal disease that captured her attention, and she was able to take advantage of the hospital's Department of Research, excellent library, and well-developed research foundation. After realizing her affinity for research in sexually transmitted diseases, Dr. McCloskey traveled to London to earn a diploma in the field and is properly called a venereologist. Venereal disease is an insidious opponent for any physician, spreading as a vector of illness that takes advantage of the very human urge to procreate. To combat its spread, Dr. McCloskey earned a Master of Public Health from the University of Western Australia, ultimately completing a PhD from the institution. Public health physicians like Dr. McCloskey must take into account the human desire for intimacy and recommend working practices for entire societies down to individual persons. Simply being aware of the pathogen that causes a venereal disease is often not enough to curb its spread. Germs, such as the human papillomavirus, are already widespread among human populations and continue to escape doctors as they travel from one sexual partner to another. As of 2017, the World Health Organization is battling syphilis, neonatal herpes, chlamydia, as well as antibiotic-resistant gonorrhea. It recommends improving contraceptive access and taking many steps to advance sexual health education around the world. For Dr. McCloskey's part, her primary work is treating patients as a venereologist and traveling the long roads of Western Australia to teach health professionals, community groups, and Aboriginal communities. In December of 2016, ABC News reported a rise in sexually transmitted infections in the area, with more than 3,000 diagnosed cases of gonorrhea and over 300 cases of syphilis. The department promoted safe sex practices, including condoms, as the best way to prevent infection. As for the human papillomavirus, it is the most common transmitted disease vector according to the Center for Disease Control and Prevention and often does not exhibit symptoms. Dr. McCloskey's research adds to the body of knowledge about the virus, but even with several vaccines already available, it is an incredibly common infection for many sexually active adults. The virus is also tied to the development of cancer. Dr. McCloskey also gives her time to the environmental group GREENPEACE and the Australian Conservation Foundation, initially founded to resist oil drilling and mining in the Great Barrier Reef. Today, Dr. McCloskey joins over 400,000 people in uniting Australians with nature and holding officials accountable for responsible stewardship of the environment. She is also a member of the International Fund for Animal Welfare, which rescues and protects animals around the world. Dr. McCloskey serves the Australian public from one of the oldest Australian medical institutions, the Royal Perth Hospital, which was established in 1829. The hospital is supported by the Government of Western Australia and offers a multidisciplinary health service for sexually transmitted disease. Notably, this suite of care includes mental health services, which is often needed by patients who acquire the infection through traumatic experiences. Dr. McCloskey also serves the medical community as a member of the Australian Medical Association Limited and an elected fellow of both the Royal College of Physicians and the Australasian College of Venereologists. Notably, she is a member of the ASHM, or the Australasian Society for HIV, Viral Hepatitis, and Sexual Health Medicine. The nonprofit society supports sexual health workers like Dr. McCloskey in Australia and New Zealand for research, advocacy, education, and policy making. With the support of widespread social and political cooperation, public health policy can make a dramatic difference to the fight against venereal disease. Dr. McCloskey intends to go on doing more of the same type of work and hopes to gain further recognition for her research. In her free time, she enjoys skiing and the Chinese exercise of Qigong.